There's your two muscles. There's the nerve. If it drags there, then one of the classic tests we do, we lay on the couch, you've just come in, and I raise your leg up and you go, ooh, ooh, ooh. And that amount of lift can cause you pain. So I go, okay, your nerve isn't gliding. I don't call it sciatica, your nerve isn't gliding. Let's free your nerve off. And all of that is designed to glide the nerve again. And as the nerve glides, you're also repatterning the fascia. So we're getting rid of the contraction, lengthening the facial band again, letting the nerve glide. And you do those three things and pain's gone. That's why you have pain. Once you do these nerve glides, it disappears.
So this is the psoas muscle attaching to the front of the spine and then down, right down on the inside of the hip. So we've got one muscle pulling on one side and then we've got another muscle the same on the opposite side. So if one of these goes into a spasm, that's what can actually start to rotate the vertebra, putting pressure on the discs and actually causing a lot of the sciaticas, back pains and tensions.
We need to be made more aware of our body, rather like animals. They get up and we call it a stretch. It's actually called a pandiculation that a dog does or a cat does. And we need to learn to use our muscles in a way that's not stretching. And that again is part of this program, to show you how to reset muscles, and muscles then do the proper postural work. Anatomically, you're taught that this is a muscle, it starts and ends there. This is another muscle, starts and ends there. When you start to look at longitudinal fascias, it's part of a chain, and what you're looking for is the weakness in the chain. Now, when you find the weakness in the chain, you can then fix it, but it's better to fix the longitudinal length of the body. So we look at the body in this way, that the quad muscle could be from gardening, kneeling, something like that, becoming strained. That's going to strain the psoas muscle. That's going to become the diaphragm.
We've also got the esophagus coming through here as well. So if the diaphragm starts to tighten, that could actually trap the esophagus. So we could be getting things like acid reflux or poor digestion, or it could be putting pressure on the aorta. So we could get cardiovascular problems or heart problems from something that's muscularly, we think, our back's gone off.
The belief, osteopathically and chiropractic, is that a bone is stuck. Now, if a bone's stuck, it needs force. Lock up the vertebra. So it depends if you're going for a fifth lumbar or the sacroiliac. You'd lock the ligaments, you'd lock the joint together, you'd get yourself in a good position, and you'd make a hard thrust. You'd hear a nice click, a resounding click. The person would get up and say, oh, that's different. And all it was doing was putting that joint in it. It doesn't do much for the ligaments, it doesn't do much for the muscles, and actually it puts more rotary torque on the joints. So then I learned a chiropractic system that taught me that rotary torque adjustments actually made the joints worse over time because they calcified up. I was taught a different method about 1980, where a chiropractor developed these two blocks, and what he found is that the way the pelvis goes out, it's got a slight rotary torque to it. So we'd use these almost like a little leverage. So you put one side of the pelvis, and depending on what the pelvis was doing, you put the other block on the other side of the pelvis, let that reset for several seconds, and then take them back out, and it levered them back in without any force. So that totally made my belief change that we didn't need force. So that stopped using forceful adjustments from that day forwards. Muscle in the pelvis called the psoas. Most pain is caused by this muscle, or a muscle called the piriformis at the back, going into protective spasm because the body's losing its alignment. The hypothalamus in the brain says we need to be level. So it starts to bring us back to level. The only way it can do that is to make some muscles go tighter. Now, when a muscle goes tight to protect you, it can't be used as a moving muscle anymore. So now we limp, we put more pressure on our joints, everything gets worse till someone comes along and changes that.
The pelvis almost acts like a spirit level in the middle of the body. So if that's sitting at the right position, that gives the platform where the spine sits on top of a stable platform to sit on. So if we've twisted, become distorted through whatever way, and now we've got a misaligned spirit level, we've now got an unstable platform where the rest of the spine's sitting on top of. It becomes the calf muscles, then that doesn't stop at the calf, it actually becomes the hamstring muscles, then becomes a ligament called the sacrotuberous ligament, then becomes the erector spinae muscles, and that goes all the way up to the top of the head. Tension in the foot, tension in the calf, tension in the hamstring could be affecting right up to the top, so you could be getting headaches or migraines or dizziness from something that's going on way down here, or you could crick your neck or sleep funny, and then you could start getting back pain, tight hamstrings, or plantar fasciitis. One of the key reflex points for the psoas muscle, which is the lower back muscle that we looked at, is right in the centre of the sole of the foot. Enough to make a fixed point and then doing the movements that James is demonstrating. So taking the leg out to the side, gently, just as far as feels comfortable, taking the leg then in towards the midline, and doing that, repeating that about 2 or 3 times, that same movement. And this is a small muscle called the piriformis. Actually comes and attaches to the outside of the hip. Now the sciatic nerve, which comes from the lower spine, actually goes underneath the piriformis and another muscle called the gemellus. So you could have a bulging disc up here because of the pelvic imbalance that's putting pressure on the nerve at source, the nerve root, or the piriformis muscle could be tightening, which is starting to nip the nerve, and that could be given the classical symptoms of sciatica anywhere down the leg or even into the foot. Pelvis that we've just looked at, and then it goes right across to the opposite side of the ribs. So anyone who's doing anything one-sided, a one-sided sport, sitting in a car for long hours on a computer, then if this rib cage and this pelvis is moving very slightly towards each other for a long period of time, then this band, because obviously we've got another band coming the opposite direction, then one of these bands becomes over tight. So that could start to pull the rib cage down on one side, the pelvis in on one side, and that could actually affect the internal aspect of the body. So we've got all of the organs in there on the pelvic floor, we've got the digestive muscles, we've got the diaphragm and the breathing muscles. But if that starts to become distorted, that can actually pull the pelvis out of position or pull the rib cage out of position.